Welcome in, everybody, to the Bare Knuckle Recovery podcast. As always, I'm Tommy Streeter. This is Nate Mollering, and this is episode 21.
21. As Tommy said, our podcast is not old enough to drink.
It is.
Yep. But it's sober, so it doesn't drink.
Yes. Water and Red Bull, if you're Zach.
That's right. Caffeine and water.
Yeah. So, as you guys can see, we've got two guests with us today. You all know Zach if you've been following our podcast or have been following Bare Knuckle Recovery at all for the last 2 years. You guys know Zach. We brought him back on today. And then we also have Jaime Murphy joining us today. Jamie's kind of a behind-the-scenes member of the Bare Knuckle Recovery team, but still just as much a member as anybody else. So we wanted to bring Jaime on today to talk about recovery and mental health in the professional environment, right?
Absolutely.
Yeah. Wellness in the workplace.
Yes.
That's really what Jaime specializes in. She helps make a lot of connections with us, with professionals in our own communities. She's a part of a lot of different human resources groups, all kinds of stuff like that. I don't want to ruin it or butcher what Jaime does, so I'm going to let her introduce herself and tell you guys a little bit about who she is and what she does, and then we will dive into that, and you'll see why Zach is here later. We just needed another pretty face on that couch.
Zach's going to talk about the Bengals.
Yeah.
He's a Bengals fan, unfortunately for him.
All right, yeah.
Or fortunately.
Yeah. Unfortunately. Anyways, go ahead, Jaime.
All right. Well, thanks. I'm glad to be here. Part of the discussion, I think, today has to start with sort of looking at my past, which involves a lot of different parts. And I started out in that HR world back in the day, but I was a social work major in college. And so I've always been in the realm of sociology, psychology, things that I was interested in, but went directly into human resource. And that over the last 25 years has changed dramatically. Being in HR kind of made me, I always say HR people are sort of the social workers of the business world. They have the heart oftentimes, but they also understand business sense, and they have to marry those two things together effectively in an organization. So my first outreach is usually to HR folks or people that are fulfilling that particular task because it's pretty overwhelming, all the things that they endure. And then also a lot of the day-to-day interactions with employees is done by that particular position. So, but I have an insurance background as well, so that's where I kind of started diving into just different plan designs, how you can cover, first of all, medical needs that you have, and working with groups that are either self-funded or fully insured, and the restrictions that come with those, and setting up programs. That also has changed dramatically in the last 20 years. But I would say, and I'm aging myself by saying that, but I've been around, so what can you do? But that has been sort of an area that I do still stay up on. I keep my license current, those particular things, because of those particular things that change in that world all the time. That's kind of what I do in a roundabout way. I have a health background too, working with managed care, so that's where a lot of the contracting comes in, and understanding how you can build a contract for organizations to support things like mental health resources, and then also working with anyone that maybe needs inpatient or outpatient care. What does that look like in the world of recovery and addiction? So that also has changed a lot, I would say, in the last 10 years. Specifically in the last 5 years, I've been focused really solely on mental health and I guess in all parts of the recovery process. And that can be recovery from not just addiction with, drugs or anything like that world, but also eating disorder, gambling, all those things, because the components of that overlap a lot to, understanding trauma and all the things that are sort of have to be brought to the table to discuss. The reason that I do really focus strongly on organizations, especially for-profit, is it has always been in the past sort of a nonprofit focus, is taking care of the individuals that possibly need those resources or assistance. And it's not been talked about openly in the business world. But you have such a controlled audience when you have employees, and you, as a business owner or a leader in your particular organization, need to be sensitive to that, because you have a lot of control over that. You have a lot of opportunity to provide education, support, good programming, things that can really actually help keep employees longer, make them more dedicated, but also create an environment where they're actually excelling and giving you and driving ROI in the way that you need it. So that's kind of where I'm at right now. And I love being a part of Allendale, of course, because you guys are focused on a lot of different avenues and ways to get in to reach people, which ultimately is getting them into the care that they need. And you're very focused on the person, just as that would be sort of my philosophy too, is that you have to stay focused on the person. And it is not a cookie cutter model, but we can work together to figure it out.
Yeah, and it seems like a lot of employers are getting more involved in the substance use mental health side of things, partly because in the United States we have an employer-based healthcare system, right? So you get insurance through your employer. And then oftentimes your family, your dependents are covered on that as well. So it's kind of something that is becoming more and more necessary that they're educated on it, because they're kind of the linchpin for people receiving treatment for substance use and mental health, right?
Yes, absolutely. So, the first stop really is going to be your medical insurance. That's usually what most people think. They leave out some of the other benefits that are available to them. For example, employee assistance programs, even understanding short and long-term disability and how those can be put into play, FMLA. There's so many different parts of your benefit package that actually can be a benefit to someone that's seeking some type of treatment. But understanding that, I see lots of times in organizations where, first of all, insurance is complicated to understand anyway. Like I said, I have an insurance license, been in that world. My husband won't touch the stuff. Like, he brings it to me, and I even struggle trying to figure out plans. So it's hard to expect someone that's in sort of a layman, it's not in layman's terms. And so everyday person's not going to understand how to navigate that. So one of the first things that I encourage organizations to do is that they get a really good education program around their benefits, and that their middle management as well as their leadership all understand what those resources are and don't always refer back to human resource. Know them yourself, because if you are possibly in a situation, maybe you're in the hallway and someone stops you and says they're struggling with this, or even from a medical point of view, what do I need to do? They need to have some things that are, top of mind, and your health insurance can drive that. But there's lots of other great resources out there. So.
Well, and I would guess that most employers, business owners, upper level management, executives don't even know that there's different kinds of plans that may impact their employees' ability to obtain treatment, right?
Absolutely. So there's a lot of, there used to be, restrictions and carve-outs where they would restrict certain types of care. Those can happen in some ways. We don't like to call them carve-outs anymore, but sometimes they can have pretty specific wording in their plan documents that actually drive the type of care that they have. That can be seen by many as a negative thing, but it's actually a really good thing, because if you have control over that plan, you can dictate then what type of care that person gets, because it's really good care, that it's medically backed, that they're going to receive continuum of care afterwards, especially if they're in an inpatient situation. There's a lot of control in that there, and I really encourage, especially business owners or anyone that's making those types of decisions, to really look at that as an advantage and not be afraid of it.
Yeah.
Because there's lots of opportunity to make those changes.
Huge amount, yeah. So we're going to spend the next hour calling out different employers. No, I'm just kidding. No, I mean, the purpose of this episode is kind of educate people on that process, right? So it sounds like it's just incredibly important that employers educate themselves, because, again, you are the one who kind of, when you pick the plan, you're deciding, does this person have a lot of options? Do they have few options? And oftentimes, again, as I stated previously, I'm going to reiterate again, their dependents are often at the mercy of that insurance plan as well.
Absolutely.
So what are some things that some business owners, executives can do to try to make sure that they're protecting their employees and their dependents, but also not break the bank, right? Because we know that that's a big part of it when people select healthcare plans.
Yeah. So, it's always usually financially driven. Unfortunately, that has to be the decider, just because insurance just in general is expensive. The other part of it, though, is and you have to kind of look at those that are, and I'm speaking more from a self-funded conversation, because fully insured is set up very differently, and there are different restrictions that a smaller employer would not be able to make changes to. They can always add to, but they can't make changes directly in that plan. From a self-funded world, though, there is a little bit more leeway in that, but it is usually financially driven. If you do work with a broker or someone that's helping you make those decisions, I think it's important for anybody that's making, whether it's benefit manager, owner, whatever that is, to really feel comfortable with their broker and be able to dive into some questions that are considered beyond the financial aspect of it. Because if insurance is not used correctly, the plan can still cost you money in the end. It can cost us all money in the end, because what I say too is, if your deductible and out of pocket, for example, is too high, and someone keeps showing up at the emergency room, your community eats that cost eventually. And so it's important that people understand how to navigate the healthcare that they have access to, and that your plan is benefit, I would say, like full of benefits that can be used within a range that does control cost, but allows for some choice, because people also want that too. They want to be able to have the autonomy to make decisions for their health.
So would you say it's important for executives and owners and HR people to understand kind of what local resources are available and really begin to do their homework on which options they may want to use, and then reach out to them and begin to learn a little more about them and see how the plans would interact should they need it?
Absolutely. So first of all, there's a lot of free resources in every community, especially for mental health and recovery and addiction services. And so a lot of those agencies want to partner with businesses because that's a way for them to get the word out for the services that they offer. Within your plan, though, you can start matching that up. So what does your list of therapists look like in your community?
Right.
Is it really within range when someone has to, for example, has a dependent that might need to have some, pretty intensive care? Maybe that's seeing a therapist a couple times a week, having that flexibility to do that. But if that person is 25 miles away and they've got to pick a child up at school, then drive to the therapist, then possibly drop the kid back off at school again. Like, what's that look like? And that is something that makes it really difficult, I think, when someone chooses a plan that really have limited services that are within your network. So we talk about in-network and out-of-network benefits, and that's a whole nother discussion. But trying to keep people in network is really the best way to, focus on savings, but also should be the best option for your employees so that they're getting the care that they need and it's not too difficult for them to receive the care. The easy option is the best option. And so it's not always, when I say that though, your easy option should be a valuable option, meaning that they really are following guidelines that, that show proof that it works. So one of the things that I love, like for example, Zach being in community outreach, like he becomes someone that's automatically, after I've made the relationship, let's say with a business, that is the first stop, that if they have questions and all of those things, that person's there, they're already, so that relationship's already set up. But prior to that too is really taking a look at, second chance policies and different things like that. What do those look like within your building? Like, do you have policies that support that? Because a lot of people don't have, and that's one of the things I can do is help with those policy writing or even just taking a look at policies to say, like, this is a positive, it can be looked at in a positive light. There's also so much still the stigma of different discussions. I think a lot of people are afraid to step in too far because we have, laws and HIPAA and confidentiality and privacy. But also, with mental health and especially, I would say, even with substance use disorder, a lot of people really don't know. And so they're so apprehensive to sometimes step in. So that's part of that pre-work that needs to be done too. What do you need to know as a professional to support the employees in your organization? That works with policy, that works with your benefit plan, that also then works for sort of the recovery culture or the concept of having psychological safety within your organization. And that looks different for each organization. And those are some of the things that we can do is actually have that discussion with them. Like, what, do you do an employee survey? Do you ask any mental health questions on your employee survey every year? Do you talk about those types of things? Do you have a leader that's experienced something personally and they're willing to share? Those are ways to start sort of changing that and maybe stepping into those discussions to sort of create that atmosphere where people feel comfortable and step forward.
I have a funny story that goes right along with what we're talking about, and I didn't even think about bringing it up until just now. I've used this story as an example before when I've gone into different companies and tried to talk with their human resources person on why it's important for that person to know and be familiar with resources in their community in case they have an employee or an employee's dependent that comes to them and says that they need help. The first time I went to rehab, I know you've heard this story before, but after, it was in 2014, so I had been using heroin for a few years at this point, and I kept losing jobs and getting arrested, and my dad stopped me in the kitchen one day when I was living at their house still, and he was like, "Dude, you look like, what the hell's wrong with you?" Like, what's going on? Like, you keep getting arrested. You can't hold down a job. My mom loves it when I tell this story, by the way.
Happy times.
Yeah. So I told him, what was going on. I didn't tell him everything, but I told him enough of what was going on. And this was on a Sunday night, and he's like, all right, well, by, Tuesday or Wednesday, we're going to have something figured out. And he had no idea what to do. My mom had no idea. Well, we didn't even tell my mom at first, but he didn't know what to do. So he went to his HR guy. And this is nothing against his HR guy. He was, genuinely trying to help. He just didn't know what to do. So he got on Google, and he ended up finding this place that was out in the middle of nowhere in Goshen. And I don't know if you've heard this story before or not, but so like 2 days later, they take me to this place and they drop me off there. It didn't accept health insurance at all. So they had to pay out of pocket to take me there. And within the first 48 hours of me being there, I realized everybody that's here is getting high. There's 8 other guys that are there's just this house.
It's known as a flop house.
Yeah, it was not a treatment center. It was not a hospital. It was literally a farmhouse. And it was a really big, nice house on a huge chunk of land. But I didn't know any better, and my mom and dad didn't know any better. None of us did. So I'm at this house for a couple of days. I realized everyone here is getting high, and I've got my cell phone, which that should have been a red flag right off the bat for my mom and dad, but they didn't know. So I ended up having somebody bring me a bag of heroin a couple of days later and a bag of syringes, and long story short, I ended up overdosing in the basement on the same day that my mom and dad were there to visit. My dad's the one that broke down the bathroom door and found me on the ground. But
it was a holiday too, wasn't it? What holiday was it, Tommy?
It was Father's Day,
Oh.
actually.
Great Father's Day gift.
Yeah. So
Thoughtful guy.
I literally did not even know they
I'm
were
just
there. Obviously it wasn't intentional, but yeah. So again, it just goes back to us not knowing what to do at the time. My dad's HR guy, who was trying to help, he found this local place that he thought, well, it turns out this place was not licensed by the state. The doctor that was in there was not an actual doctor, so he was writing, bad prescriptions. The woman that owned it ended up, so after that happened, my mom filed a complaint with the attorney general, and that place ended up getting shut down. Yeah. And the woman that ran it went to prison. But I use that story as an example when we're meeting with different companies and with HR departments to be like, look, this right here is exactly why it's important that you guys are familiar with the resources in your area, and you're not just getting on Google and trying to find the first place that pops up and be like, yep, here you go, call this place, because that's what we did.
Right.
And granted, that was in 2014. It was before Google created Legit Script, and anybody could just advertise as a treatment center on Google without being licensed by the state. And thank God that's not a thing anymore. But still, you want to actually be familiar with the resources that are in your area.
Certainly you do. So, yeah, and that's one thing. If you do want to get a crash course on how to pick benefits, structure benefits, obviously you can reach out to us. Jaime would be happy to speak with you. But if you're looking for kind of a treatment liaison, someone to help you kind of work through getting your employees and their dependents help, it'd be someone like Zach. Would be the person you reach out to through Bare Knuckle Recovery, Allendale Treatment, but also, Remedy Live, which we're in Remedy Live Studio, does a really good what's called Wired tour, which is they come into your place of business and they partner with Bare Knuckle. And they will ask your employees anonymous poll questions in real time. And actually, it's wonderful because you get all the data at the end. We don't do anything else with the data. You get the data. And you can make informed decisions on your health insurance, on your EAP program, and on what kind of resources you might need for your people, right?
Yep.
And it's asking the tough questions.
It is.
It's, do you have anyone that's struggling with substance abuse? Anyone struggling with mental health? Are
Suicide.
you struggling with those types of things? So it's not just cookie cutter questions. They're really throwing the hard questions at people, which is really amazing.
Yeah, it's not the DARE program. It's not like this is heroin.
Yes.
Or just say no.
Yeah, right. Just say no. Yeah, if you can.
One thing that kind of makes me think about too, and is really using data that you have available to you, especially as a business owner. And a lot of people make really informed decisions about their business, but don't use all the data that's available to them to make really good decisions for someone's care and for their team care. And I think that that's pretty important to kind of recognize because with Remedy Live and doing the wider experience, I personally had it with a group of business folks last year that did it. And we found 2 people in the group that were suicidal.
Right.
And so going through that process with them, and what was very impactful from a business standpoint is it brought it home for them to see physically that there was someone in that room of 70 people that really felt that way.
Was that the one we did?
Yeah.
So,
And that had a huge impact. So being able to kind of see that firsthand, but then also being able to take a look at the data that, like, I always ask a lot of, benefits directors, HR, like, your EAP and your employee assistance program, there's some really great ones out there, but there's some that are really just an add-on to another benefit that you already have. Are you able to get information like how many clicks have the website's got? Like, what's an area that seems to keep getting hit? Those are really good ways to help map out a good plan for your organization. These are things people are struggling with, so let's not recreate the wheel. There's great resources here that I can pull on and actually, because it's not just one person.
No.
It's probably a large, maybe quantity in your group that needs that help.
Well, the one you guys did, I think before Tommy spoke, it was 0, but after Tommy spoke, these 2 people wanted to kill themselves.
Yes. He was like, ruined the whole day, basically.
Suicide's really not a joke. We joke about these things because we deal with it all day, and you have to laugh at some point because
And sometimes it's not
heavy.
been my world, so I'm like caught off guard. I'm like, oh, should I laugh at that?
It's heavy stuff, so you do have to laugh. But no, I mean, it is one of those things that you're shocked.
I thought you were like praising me for doing such a great job. They were willing to come forward and tell the truth about how they were feeling.
Oh, I think they were ready to be out, man. They were like, after this guy spoke, there's no hope. So no, I mean, but it's you really do start to, it shocks people though. We'll have rooms full of executives, high level people, type A personality, ground and pound, hit it hard every day. Don't take, there's no such thing as no excuses. And there'll be, 15% think about suicide on a regular basis or have attempted. And people are like, oh my gosh, I didn't realize people were struggling. I mean, we've had groups of police officers and firefighters and some of the toughest people you could think of, right, who have been through this. So you'd be surprised how many people in your organization could identify as someone with substance use, mental health issues, suicidal ideation. What happens, and we see it every day, unfortunately, and that's why we joke around like we do, because again, we just have to deal with it a certain way. Otherwise, it'll eat you alive, and you'll end up breaking down crying instead of laughing. But so many people, businesses, organizations say, we wish we would have known after somebody died, right? And so this is your opportunity to kind of get in there and to make sure that people have a way to kind of say, hey, I'm struggling, right? Because again, when you're standing there at a funeral, everybody wishes they could turn the clock back, but you can't. But now you can do something, get ahead of it, make sure your health insurance benefits are taken care of, make sure your people have good options, and then bring in some kind of program to have people be provided some sort of outlet to say, hey, like, these are resources we need. And the great thing is it's anonymous. So it's not like this person over here, we're going to have them stand up in front of the class and ask them why they wanted to commit suicide. It's, we know someone's struggling and, we'll have this available for them whenever they need it.
Yeah. And I think that one part of that too is like it goes beyond, like we jumped right into like, how do you pay for things? Cause that's usually like the biggest question that I get from anyone that's a business leader.
Businesses and individuals, right?
Yeah. And so that's what I was actually going to go to as well, is like making sure that you're reassuring your employees that, first of all, that's what that policy, that concept of talking about even an orientation when they're first in, like, we have this available. It's so important for them to understand that it's confidential, first of all.
Yeah.
Or if you need an outside person to speak with and you don't want to speak with anyone within the, the business that you're in, here are some other ways to do that. But making sure they understand that they're not going to lose their job, because in those situations where someone is the breadwinner in a family, especially, if they're the sole provider, that's very scary for them to think that, like, I did not see this escalating to the point that I'm at, and I have, a family to take care of. And that's scary to think that I can be away for 30 days, possibly, if that's the, the option, and how am I going to pay for that and what's that look like? And on the other side of that too, I hear, I get asked all the time, I've been at meetings with you and you, where they say, what makes you say that you're more successful, or what makes you know that your program's that good? Well, honestly, there's a possibility that it's not going to work the first time, just as, everybody, Tommy shares. But I think the point is that you're not in control of that as a business owner. You are not in control, nor do you get to make that decision for someone if it's their last chance. Now, as a business mindset, you can decide that maybe you're only going to allow for the opportunity one time that you're going to financially support or help. It doesn't mean if that person needs treatment again that there may not be another way to do it. So I think that it's never a yes or a no or black and white. I think it's really taking care of like trying to protect the business, confidentiality, all those things are important from that world, but also not losing empathy and the people focus on the other side of it and trying to meet people where they are.
Yeah.
And the best leaders do that. They recognize that I don't have all the answers. So let's bring people in here that can help us figure that out. And I always say too that like anything that is out there in most cases, nobody's wanting to come in, or at least I would say from our point of view, we're not coming in to replace anything that you have. We're coming in to help you use what you have available that you're probably already possibly paying for, but also too to like really take it to the next level and to add another layer to that and walk alongside everything that's already in there. It doesn't mean that we might say like, have you thought of another option? Because our eyes have seen a lot of different things and we know in certain aspects what works and what best practices can be put in place. You know, in past discussions with Zach, we talked about sort of his process of getting to where he's at right now, and he is one of the good ones. I feel like a great story as far as, yeah, right. But he's got a great story of an employer that was supportive of the process that he was in and also had some accountability and also transparency in the whole process. So I'll let you go ahead.
Yeah. When I was in my very last inpatient stay, one of the guys that I was there with, he was like, hey, we should get a job together when we're done with this. And I just was like, yeah, sure, whatever. So I got out and then he got out.
I'm not getting a job. What are you talking about?
Jobs are for suckers.
But I never got it or never called him, never contacted him. But I went to outpatient and lo and behold, he was sitting right there. And he was like, yeah, like I already got a job. I started, come over. So I was like, yeah, okay. So I went over to this place and that he told me about, and he's like, look, you just have to be honest with them. As long as you're honest, they'll work with you. Okay. So I went in there and I actually interviewed with one of the owners of the company. And he, gave his whole spiel, like, this is what you would be doing, everything. And that's when I said, hey, look, I'm new to recovery at this time. I think I had like 2 months sober. And I said, and I'm on drug court. So every Monday I need off because I have court on Monday. And then on top of that, I have all my outpatient stuff on Monday as well. I was like, so unfortunately I can't work any Mondays. He said, that's no problem. He said, what was your struggles with? And I said, heroin. And he said, okay. He's like, I don't know if you know this about this place, but I am a second chance facility. So I hire a lot of people with felons, substance abuse, mental health, things like that. He said, because I don't know if you know about my family either. He said, but I would say half of my family is in recovery and the other half are still struggling with their addiction. He's like, so we have this foundation. We want to give people second chances. He said, the only thing that I ask of you is to be honest. If you're struggling, let me know because we'll work something out. And because you can't work Mondays, I may need you to work some Saturdays. Okay. And he gave me everything that I ever wanted.
I like that he made you work Saturday, though. Since you couldn't, that's a great compromise.
Yeah, absolutely.
I think that's awesome.
Yeah.
It's an accommodation that is could be easily met.
Yeah, and it wasn't every Saturday. At the times, I think I started working 4/10s. But if he needed me on Saturdays, I never said no. And plus those days were only, 5-hour days or something easy like that.
But he created a relationship right there with him that said, it made you basically, dedicated.
Yeah.
He's working with me. I'll do whatever he needs.
Yeah.
Because he's honoring where I'm at in my place right now. And that's an important point to say is that relation then is reciprocal right off the bat. So,
and it was a really big company, actually. I mean, there's well over probably 200 employees, and every day you would see him out on his golf cart riding around and he would stop and talk to like almost every single person in there.
It's awesome. Great leadership.
And he would actually ask you how you're doing. It's not like hey, and then just keep driving on. And, he made special accommodations for me because then, through drug court, if I had to take a drug screen, their hours were only from 8 a.m. until 4 p.m. I'm working that entire time. So on my lunch, he would say, go do your drug screen, stop, get something to eat, and then on your way back, if you go over 30 minutes, it is what it is. it's not that big of a deal. So the great thing about that is he could also keep an eye on us. He did drug screens for us. And he gave us really good care of benefits. At the time, I wasn't really taking advantage of them because I couldn't afford it. But come to find out today, it's a really great policy. They work with any addiction treatment facility, substance abuse, mental health, things like that, to really ensure that their people are still getting the care that they need. And man, they just went out of their way to do whatever they could for me. The biggest thing and this is actually the story that actually made me want to help others in my recovery. I had about 2 weeks left at the halfway house that I was staying at, and I'm working there. I just celebrated 1 year of recovery. I've been doing really good, and funds are tight because I still have to pay the halfway house. I had my mortgage for my home. I had a daughter.
Yeah.
I had, all this stuff, and my wife is pregnant now at this time, and I was struggling financially, and I never once said anything to anyone. It's not who I am. I don't put my business out there like that. And one day, the owner came out and he said, "How are you?" And I said, "Well, I'm all right." And he like really started pressing me, and he's like, "No, seriously, how are you? What's going on with you? I can tell just by the way that you're walking, something is wrong, something is off." And I said, "Well, and I told him the truth. I said, I'm about 2 weeks behind on my rent. And I have 2 more forward weeks on my rent that I don't know how I'm going to pay. I'm afraid that if I don't pay it, drug court won't let me go home to my home. And I'm terrified about that." And he said, "I know." And I said, "Well, what do you mean?" And he said, "Well, I have already sent one of my people over to the halfway house, and because you have been doing everything that you said you were doing, you're working hard, you're putting in time. I paid your back 2 weeks and your forward 2 weeks." He said, "You deserve to go home, and we just want you to know that we appreciate you." And that set me out of this world because I didn't know that people like that existed. I'd never been shown love like that. Or gratitude, honestly.
And even before you shared that last part, I was going to say just him being as supportive and accepting of you as he was that first day when you met him, when you were, 2 months clean, is that what you said?
Yep.
That probably put you on such a great trajectory for your recovery because it showed you right then and there, like regardless of what you've been through, what you've done, however bad of a person you felt like you were because of all of that, there were still people who knew nothing about you that were willing to basically stick their neck out for you like that and just be supportive and encouraging. Like even before you told that last part, that's what I was thinking. Like that probably put you on such a great path in your early recovery.
Yeah.
Which that's just awesome. I don't think I've ever heard you tell that story before.
And it's crazy because like they're a very, very successful family here in Fort Wayne. Very successful. And for somebody that, is a millionaire, how many ever times over, like to show love to somebody who struggles like that really meant a lot to me. It showed me that people are people. It doesn't matter your background or where you've been or what you've done. You can still be good. And it takes nothing for somebody to be nice to anybody.
Mm-hmm.
Absolutely
Kindness
nothing.
piece of it.
Yeah.
And I think there's like 2 or 3 things that I always love about this story too, is because from, thinking from where, I pull into different aspects of being in the business world. And one of that is, like I said, that relationship was started right away. One of the things I think that's interesting too is he came from a place where he was very familiar with that world. Lots of times the business world is not familiar with that world. So I always, sort of preach practice, practice, practice when someone comes to you and has a discussion with you, or you ask the question, how are you really, or how are things, what is the answer you're going to get from them, and how are you going to then respond to that? So those are things that we can do as well as really talk to employers and say, like, you might have these thoughts over here, but it really comes down to knowing correct terminology and resources and ways that you can support somebody. To also then, if he didn't want to be that involved with it, that's okay too. If a business doesn't want to be directly in that relationship, there are other ways to handle it. But I mean, I would say one of the things too, I have a gentleman that I had worked with a long time ago, and he had been incarcerated, had struggled with addiction for many, many years. And I was in the recruiting era during that time. And he did not have access to the steel-toed boots. And that was a requirement. And he had been out probably for about, I'd say maybe 3 or 4 months working odd jobs, things in that world. But I was like, I'm just going to go buy him. Like, you're not supposed to, but I'm going to do it anyway. But there was something about him that I really felt like he was on a path where he was very honest, very open with me, and really wanted to do well. I ended up being at a gas station a couple years later, and he tapped me on the shoulder, and he had tattoos like you, but he also had them on his face. And so I turned around and I didn't recognize him at first, and he said, "I remember you." And I said, "Really?" And he was like, and it took me a minute, and I said his name, and he said, "I am now in upper management." He said, "I stayed. They gave me an opportunity to work there." He had been there then for probably about 6 or 7 years. And he said, "It all was because of steel-toed boots. I would have never got to start there if I didn't have steel-toed boots."
Yeah.
So being able to set funding even aside for your organization too, to support people when they're in transition, they need a little extra help. Or when it comes down to like, you've worked so hard that long, why would we let someone lose in that process because they're missing 2 weeks of rent?
Absolutely. Yeah. And I think it's just, I'm sorry to cut you off. 1 in 10 people is what they estimate struggle with substance use disorder. So you're going to come across somebody in your organization, whether you recognize it or not. So I always encourage people to get educated, whether it's through reaching out to Bare Knuckle, Allendale, or Remedy Live, somebody that you trust who can educate you on what's going on, how to approach people, what to look for. Because as Zach's stories highlight, it could be a pivotal moment in someone's life. You have a chance. I think a lot of people think, what can I really do? The problem is so big. Like, how could I even, I'm just a manager. I'm just a business owner. Like, you don't even know the power that you have to have an impact on somebody's life. And, not only did they save Zach's life, but, they saved, Zach has 3 kids. He has a wife. He has a mom. He has a dad, right? So when somebody loses their struggle with substance use disorder or mental health, it doesn't just mean that Zach's gone. It means that his wife is now a single mother, and the kids don't have their dad, and his parents are without their child, right? And now the employer also is without the employee. We look at the deaths across the United States. When you look at alcohol, over 100,000 people a year alcohol, over 100,000 people a year drugs, suicide's a high rate. I mean, those are all what we call deaths of despair, right? I mean, it's no wonder that employers can't find people to fill the positions.
Sure.
And the people who haven't passed away are struggling many times, right? And so there's people all the time falling out of the workforce. I think now there's 7.2 million able-bodied men between the age of 25 and 52, 54 maybe, who are not currently looking for work. And a lot of that probably has to do with substance use and mental health. A good number of them were in the workforce at one time or another. So if you can head that off and some early intervention through, good policies at your work, and also just being educated as an employer, having some resources at your fingertips, and then just a little bit of human compassion, right? At the end of the day, you could be a huge part of the solution. We talk all the time about, people hear my story, Tommy's story, Zach's story, and say, well, I don't really have a story. I don't know how I could really help. I don't have a degree, and I don't really have lived experience, but you have something to offer, and if you're an employer, you definitely have a lot to offer. You just may not realize it yet.
And one of the biggest things with that is the education part, because yes, he gave people that struggle with substance abuse chances. So he also knew what a relapse looked like, or, the boundaries that he should hold, because he gave the second chances. It was like, hey, you're a great employee. We want you to continue here, but you cannot continue here while you're using, because A, you're going to hurt yourself, and B, you're going to hurt somebody else. So giving them that opportunity of like, hey, you relapsed, let's get you back on track, go to treatment, figure this part out, or do something for your recovery, figure this part out, and then when you're good, you can come back.
Absolutely.
And that was huge for so many people. Yes, did they have relapses? Absolutely, it happens. Somebody that's new to recovery, you give them that first piece of money, it can drive somebody wild. But to give them that opportunity of like, Okay, you got it out of your system. Let's figure this part out now. Don't run. Figure this out. It's having those hard conversations and the knowledge to know, like, okay, somebody did relapse, or
But also then still having boundaries within, it's still a business
Correct.
that has to run. So there still has to be policy and procedures and making sure that you're covered. There's times you're going to need legal advice to make sure you're doing the right things, or use different resources to make sure that you're, covering that part of it. But I think, I always use the example, there was a study several years ago about how we compare, for example, substance use treatment versus a diabetic, and how we're getting better at talking about it as addiction being an actual medical issue, that it is actually garnered in that. There are a lot of things that impacted that. And a lot of people think of it's, poor upbringing or these socio kind of economic things that have happened. That's actually not true. And it being medical, just in the same idea, they looked at cardiac patients and diabetics. And within that first year, the diabetics and cardiac patients also relapsed with their treatment plan. It's very but that's okay. We allowed them to have another heart attack or possibly, harm themselves in a way because maybe their nutrition wasn't met where it needed to be as a diabetic. So why would we not also think of the treatment process for someone using, in any case, or any addiction issue, that they might have, possibly a relapse of some kind, and what does that look like? And, then just in the same right with someone that would be maybe having care for, diabetes, then, are they able to meet the requirements of the job? And what does that look like? And do we need to make some accommodations there and really kind of looking at that plan for them? And then sometimes it is parting ways, just because that's where it is, that the health is not dictating what needs to happen within the business aspect or the business goals.
So one of the things that I've been thinking about since like the very beginning of part one of this episode, when you had said something about how much human resources in general has changed in the last 20 years. So 20 years ago, if Zach walks into some company and is trying to talk to their human resources person about substance abuse and mental illness and behavioral health, whatever conversation he's trying to have with them, what would that have looked like back then compared to what it looks like now? Like, would they have like laughed at him and told him to like, yeah, we don't have that problem here for one, two, like back then it wasn't, legally insurance companies didn't have to cover inpatient treatment for substance abuse or mental health or anything like that. So would that have even been a conversation that a lot of people would have been, they wouldn't have been willing to have it?
Yeah. Yeah.
But now, majority of them, I feel like they are. And part of it, I think, is because, substance abuse and mental illness is so prevalent now. Not that it's any worse than it ever has been, but people are more open to talk about it now. So we have reduced stigma quite a bit over the last, 10, 15 years or so. So people are more open and willing to have those conversations now. So it's not necessarily a bad thing. I mean, obviously that's a good thing.
Granted, you're still going to have your people that
100%. Don't get me wrong. We'll still walk into places and they'll be like, yeah, we don't have that problem here, which we know is not true. They just don't want to talk about it, which, unfortunately that's the decision that they're, able to make. But we do always try to break down that barrier and be like, well, you might not think that you do, but if you're not asking the questions, you're not going to know.
Yeah.
So I've been thinking about that just since you said how much it's changed in the last 20 years.
Like I would say even 20 years ago, it was really not a discussion at all. I know I used to do like orientations and, bringing people in, and it was for a large company, national company. And we, would outline how the medical benefits worked, but we never talked about anything else. And then I would say within the next 7 years, especially when I went into the sort of the health world and the health systems and the hospitals, there was a lot of the wellness planning, that started like coming out, like starting wellness initiatives within an organization. And I'm always pretty, I guess I encourage groups to be apprehensive about just throwing some things out there to do for wellness.
Well, so is that like physical wellness? Is that exercise, eating healthy, quit smoking cigarettes on our property?
That's it. That's
those are all great things.
They are great things.
Absolutely.
But I always, say,
eat an apple out of the vending machine instead of the potato chips.
Or we can take everything bad out of the vending machine, but people are still going to do these things if we don't get to the other issue.
Right.
And it's really taking more of a holistic view of wellness and well-being. I like the term well-being more than wellness, just because when you look at well-being, you're taking a look at where there's kind of different quadrants of well-being as far as the National Wellness Institute and what they honor. Looking at each one of those, and financial well-being can be a huge stressor for people. Physical well-being can be a huge issue for job completion and happiness and chronic pain. Because I can't ask someone to make, especially let's say nutrition changes, if they hate themselves every day when they get out
absolutely.
of bed.
Why are you going to exercise? Why are you going to take the
Yeah.
time and energy and effort to go exercise and eat healthy if you're
when they
not
don't
happy
feel
internally?
where they, and so
I certainly wouldn't.
I think,
I'd just go do heroin.
I'm probably gonna give up right now.
but like preaching that at people too is so hard because they think
Jamie
like
just brought you to a realization.
Yeah, that's right.
What am I wasting all this time in the gym for?
I'm not there yet. I'm not there yet. But it is kind of taking it step by step and asking people like where they're at, mentally, are you able to take one step, which we know eventually is going to help your physical condition and it's going to help your, your health and your overall. I think one of the things too that I feel is really important is that dedication and the commitment that if someone does get a second chance, they are going to be your most loyal employee. They will not leave.
Yeah,
and so
absolutely.
the more that you create that type of an environment where you're known in the community as an employer that has grace, that gives possibly the second chance or is willing to have a discussion with someone openly like, he did with you. That is, we talked about the great place to work surveys all the time. That's a great place to work because they're honoring the human aspect of the human resource instead of just thinking it's like it is the person that matters, not so much the business. And those people stay for a long time.
Honestly, I struggled with the fact that I was going to leave that company to come work in the treatment field or the recovery world. And when I got that opportunity and I finally sat down and I told him about it, the owner, and he was like, no, you got to go.
I would imagine he was like, you know what, I hate to see you go, but this is what you were meant to do.
He did ask me to stay, and he, tried to give me more money.
You're a good employee. Of course he wanted you to stay.
And that was the biggest thing was I was loyal to him too.
Yeah.
Like Jamie makes that point very, very.
You drive it home well.
Yeah, it's because like especially for addicts and alcoholics, like we are loyal people,
Absolutely.
Right?
To a sense,
We're loyal to our drinks and drugs.
Yeah. We're loyal to other people to a sense. Like I was loyal to my drug dealer. Like I would have never crossed that person, but other people, like if I needed to get something, yes, but when I'm in my active recovery, I am a very, very loyal person to anybody, especially the place that is giving me an opportunity.
Because you value yourself now, too.
Right.
So now you value others. But in active addiction, you don't love yourself, so how can you love anyone else?
Yeah,
right?
and for him to say, like, hey, we would love to have you stay, but this is your calling. Like, you have this thing about you that, this is what you need to go do. So he wasn't going to allow me to stay and do this.
Have you connected with him since you've been?
I have.
Have you? Yeah.
Yeah, I have.
Yeah.
Because he is a business owner and I work for in the recovery world, and if he always tells me if he has somebody, he'll send him my way. He trusts me with that now, and he can also say like, hey, this can just be a stepping stone. If you want to make this a career, you can absolutely make this a career. But if it's another stepping stone for you, I'm good with that too. I mean, the guy's in the business world. He's going to continue to fill
he's going to be fine no matter what.
Exactly. So to give other people an opportunity is huge. It's amazing.
I mean, I think too, it kind of, I use this term a lot too, is like you have to believe in people sometimes before they can believe in themselves. And knowing
100%.
your story, like knowing your self-worth and how you felt about yourself initially coming into the first parts of your recovery, and how, that's a process too, to forgive yourself for things and to move through things.
Absolutely.
But then when someone gives you that opportunity to say like, listen, I know you can do this. I believe in what you can do next. And I think that aspect of why would you not do that for every employee, to the ability that you have. Larger companies, I know that's hard, but that's when you have to employ your middle management and really educate them, do training with them.
Well, and last thing I'll say is that it's incredibly important that you have naloxone, Narcan, within your company.
Yes.
You're now far more likely to experience someone having a medical emergency that requires Narcan, which is the drug that reverses an opioid overdose, than you are to come across someone experiencing a medical emergency that requires an external defibrillator. So most companies will have an AED on the wall. several of them most times, and people are prepped on how to use them, but a lot of them don't have Narcan, naloxone. It's a nasal spray, not super intimidating, but if you find someone who's incapacitated, they're not breathing well, you suspect that they've had an overdose, you can provide them with a dose of naloxone, also known as brand name Narcan. And the good thing is it won't hurt them, won't harm them. So
And you cannot get in trouble for using it on
not in
someone.
the state of Indiana. Other states, I don't know. But actually, nationwide, they have an open prescription now. So it's no longer, it's over the counter. Now, anyway, but get trained on it. It's something you really need to have. It could save someone's life.
Yep, absolutely. All right, well, we're about out of time for episode 21. So again, thank you, Zach and Jamie, for joining us. And that'll do it. So we will see you guys next time. Thank you for watching.
Thank you.